Diagnosis of PID. PID may be symptomatic or asymptomatic. Testing for gonorrhea and chlamydia in the lower genital tract is recommended. Since the positive results support the diagnosis of the PID, but the absence of the infection at this site does not exclude PID. Elevated ESR and the CRP also support the diagnosis, but it is also not specific. The absence of the endocervical or the vaginal pus cells has a good negative predictive value, but their presence is also not specific. What are the differential diagnoses of the PID? These conditions that are mimic with the PID: ectopic pregnancy, appendicitis, UTI, endometriosis, complication of ovarian cysts, in which include torsion or the rupture, functional pain, the pain of unknown origin. The two conditions, the acute appendicitis and the ectopic pregnancy, they must be ruled out because these conditions need urgent laparotomy, whereas salpingitis treat conservatively. What are the clinical features present in the salpingitis, appendicitis, and the ectopic pregnancy? In salpingitis, the pain was bilateral. In appendicitis, it is at the umbilicus and right iliac fossa, but it is in ectopic pregnancy, the pain was unilateral. The PV bleeding is present in ectopic pregnancy, usually present. GI symptom is present in appendicitis. The journal look was toxic in appendicitis, pale in the ectopic, and flushed in salpingitis. The tongue was pale also in ectopic pregnancy. The pulse is rapid in all three conditions. Temperature is raised in salpingitis and appendicitis, but not raised in ectopic. Tenderness, there is a bilateral tenderness on salpingitis, unilateral tenderness on ectopic, and in appendicitis there is a tenderness on McBurney point. On pervaginal examination, the tenderness on both fornices may be felt. In appendicitis, the tenderness on right fornix. In ectopic pregnancy, the mass may be felt through the one fornix extending up to the pouch of Douglas. Investigation. First of all, we rule out the ectopic pregnancy by doing urinary pregnancy test. We send the microbiological test. Vulvovaginal, we take the vulvovaginal swab for the chlamydia, gonorrhea, and mycoplasma, and endocervical swab for the gonorrhea culture. HIV antibody test, the serology for the syphilis. We must send the CBC, CRP, ultrasound scan to exclude the other pathology. Ectopic pregnancy, ovarian cyst, and appendicitis, and tubo-ovarian collection, usually normal with the PID. Laparoscopy is indicated if the patient does not respond to antibiotic within 48 to 72 hours. Laparoscopy is a gold standard test. Laparoscopy finding and the severity of the PID in mild condition, the tube was edematous arrhythmia, but there is a no purulent exudate and tube was mobile. In moderate, the tube was not freely mobile. There is the purulent exudate from the femoral end. In severe condition, there is a pyosulpinx, inflammatory complex, and the abscesses. Violin string, it is a lime adhesion around the liver, in the pelvis around the liver, suggested the chlamydial infection. What are the complications that occur in the PID? Infertility, Fitz-Hugh syndrome, abscesses,